20 days of no community transmission as at 12 midday today, and so that's the headline good news. We should always remember what is happening in the rest of the world. This is a very unusual situation to have no community transmission. Our current hospitalisation as of this morning was 10 cases in hospital, no one in ICU and no one ventilated. There hasn't been a death associated with acute COVID infection in Australia since the 19th of October. So contrast that with many other countries that are still seeing tens, hundreds, thousands, even tens of thousands of deaths every day. This remains a major issue for the world. So our situation here in Australia remains very strong. There's been a lot of discussion recently, and there should be, about our quarantine system. We have seen over the last few weeks a number of incursions related to quarantine. The most recent one in the last couple of days in New South Wales, after that day 16 test of someone who had been in quarantine and been found to be negative twice in quarantine. So that's a new development. We've seen some cases of the variants of concern, both in several states now, related to hotel quarantine. We've also seen a community case in New Zealand of the South African related strain. So these are new developments, and last week at National Cabinet there was a specific discussion about hotel quarantine and what we should be doing to continually improve the quality of our already very high standard hotel quarantine. Again, we need to put that in context. We've had over 211,000 people that have come back to Australia since we introduced the hotel quarantine system in March last year. We've had thousands of cases of COVID in the hotel quarantine, but very few cases that have leaked, if you like, out into the community, whether that be workers within the quarantine system or indeed people that have left quarantine and developed the infection. So we have a very good system. Can it be improved? Of course, all systems can be continuously improved. This is a complex end-to-end approach we have from when people plan to come back to Australia, going through the flights, arriving at the airports, going through the quarantine system, being safe in quarantine, and then after people have left quarantine. And so National Cabinet discussed that. It was the AHPPC, the Committee of Chief Health Officers that I chair, have been given the task to re-look at everything that we're doing for end-to-end, as we have done all through the last several months, to make sure that we, if there's anything we can think of to improve there, that we will do that. It will be based, as it always has been, on the best science available to us at the time. And so we've done many of those things in the past. In the last month, we've introduced that pre-flight testing. We've introduced mandating of masks on planes, mandating of masks in airports. We've continued to look at the way that people are transported to the quarantine hotels. We continue to look at the procedures and the systems and the safety of our quarantine hotels. And as of this week, New South Wales has developed a post-quarantine checkup, including a day 16 test. So I've asked my New South Wales colleagues to give a proposal through to AHPPC, and we'll be looking at that later this week around that particular component. But that's one of many things we're looking at. The other element, of course, which is related to that is the vaccine, is the variants of concern, and so we've been charting that very carefully, not only from the international information but also here in Australia. So as of the 5th of February, we've now had 87 samples of the B117 strain, which initially was found in the UK but is now being found in many other countries around the world in our hotel quarantine system. We've also had 18 samples of the B1351 strain, originally found in South Africa. And we know that that's also spreading around the world. So there's 80 countries across all 6 WHO regions have now had imported cases or community transmission of the B117 strain. and for the South African strain, 41 countries have reported that. So that is becoming the normal strain of the virus that is circulating around the world, and we need to be prepared for those strains which are definitely more able to be transmitted between people, may be associated with more severity, but that is still information we need to continue to watch carefully. And then the talk about how they may affect the vaccines. And so just to talk briefly about our vaccine program, that's all completely on track, enormous amount of work being done across the Australian government with our state and territory colleagues, with GPs, pharmacies and others that will be delivering this. Our logistics are being worked through. We're setting up our vaccine operations centre here in the Health Department to work through the scenarios of how we get those vaccines to where they need to be. We know that the Pfizer vaccine has been approved by the TGA, and we are looking very much towards a delivery of that in the coming weeks, and we're definitely on track to have those first vaccines being delivered by the end of February, as we've said, as the Prime Minister has announced. In terms of AstraZeneca, that is continuing to progress through the approvals process with the TGA. This is a very good vaccine, it's very safe, and once it goes through those processes of safety, quality and efficacy, we will be able to then look to roll out that vaccine as well, subject of course always to the TGA advice. In terms of the AstraZeneca vaccine in particular, in relation to reports around its effectiveness, particularly in relation to the South African variant of concern, I just want to make a very clear statement about people taking small amounts of information quickly without looking at it carefully and making conclusions. So at the moment, I can absolutely say, and this may change in the future, and we'll be nimble in the way we look at that information and bring that into our planning. But at the moment, there is no evidence anywhere in the world that AstraZeneca's effectiveness against severe infection is affected by any of these variants of concern. And that's the fact. What we have at the moment is a small group of people in a study which has not yet been peer-reviewed or published in South Africa, where there was an effect on the mild or moderate disease in relation to that variant of concern in that country. But there were no severe infections in any of the people that received the vaccine in regards to any of those types of the virus. So we don't have any information on that. And we'll obviously be looking at it carefully as time goes by, and every day we get more information about that. We will be talking actually in the coming days with our UK counterparts to really look carefully at what their experience is in relation to the very widespread use of AstraZeneca in that country across all age groups. So that will be helpful data for us in our planning for the coming weeks and months, and also for the TGA in their assessment.